Welcome, I'm Todd Van Ye from the Center for Aesthetics and Plastic Surgery. Hey, we're starting a new series called Technique of the Week, and I hope to be able to present different things that we do, different techniques that we do, and have another one to show you once a week or every other week. The traditional way of taking care of the neck, believe it or not, is a facelift, where we're pulling the tissues back this way, we're pulling the tissues back that way. But there's another technique that's taken off like wildfire in my practice, and that's doing an anterior cervicoplasty, where we directly address this tissue. Back about 15, 20 years, I had a gentleman come into my practice. He did not want a facelift. He did not want a neck lift. He said, I just don't like this right here. It actually gets in my way. Doctor, what can you do to get rid of this? So I directly took this tissue out with what I'm calling an anterior cervicoplasty. The disadvantage, there's a scar here. The reality, nobody in 15 years has complained about that scar in my hands. So what's the technique? We mark out an ellipse of tissue right here by pinching, seeing how much skin can I take out. We'll put somebody back supine, lying down on their back. We put some numbing medication in there. We directly excise that tissue. Now the problem is you can't have a straight line on a concave surface. So we do what's traditionally known as a Z-plasty. It's been in plastic surgery for 100 years, where we change the orientation of the skin, change the orientation of the incision, actually makes the incision a tiny bit longer, but it blends it into the natural creases in the skin, and it prevents that tightening of a scar on a concave surface. So we directly take this tissue out, and then underneath the skin and fatty tissue, there's a muscle called the platysma muscle. Those bands of tissue here that people think are loose skin, often that's the edge of a muscle. But once I've removed that skin, I very easily can see that platysma muscle. We can trim away the extra platysma. I can stitch that platysma back together here like I'm making a hammock underneath the chin right here. Then we bring that incision back together. We do the zigzag Z-plasty to change the orientation, and all the stitches are dissolvable. All the stitches are underneath the skin. We put some steri strips or paper tape over the incision, put a little bandage on, and we're done. Now, this is a great procedure for someone that doesn't want or need the bigger type of procedures like a neck lift or a facelift. Recovery is easy, discomfort is almost minimal. So it's an anterior cervicoplasty with a zigzag Z-plasty, platysmoplasty, all wrapped up in one very simple procedure that I call an anterior cervicoplasty. So that's the technique of the week. Come on in and see if you're a candidate.